Well, I think we're going to get started here. Welcome those that are in person here and those on Zoom. Welcome Zoomers and those watching the recording afterwards. Happy New Year. This is our first, obviously, council meeting of any council for the new program year, and a good happy January. And it's a great way to kick us off here. We have Dr. Curt Gingrich, Chief Operating Officer, David Dziedzicki, Senior Account Manager, Employer Services for both all of OhioHealth here, Marion General Hospital. And they're going to be talking to us today about OhioHealth, an overview and Employer Services updates, including, I believe, some master facilities plan, the Marion Cancer Center, accreditations, services, fitness and wellness programs, and I'm assuming an update on kind of what the COVID response has been in our community. So without further ado, I think I'll have whoever is going to go first kick us off here.
Yep.
Yeah, thanks.
I'd also like to introduce Vicki Church. She's an exercise physiologist within our OhioHealth Employer Services team, and she's going to be joining us today as well. I believe she's on the call to talk through some of the fitness stuff that we've been doing in the Employer Services division. So thank you, Vicki, for also joining the call today. I really appreciate it.
Thank you.
Absolutely. Glad to be here, guys.
Yeah, thanks, David and Vicki, for joining. Very serendipitous that we were able to do this hybrid. This morning when I jumped off the treadmill down in the basement and went over to grab another bottle of water, I'm like, man, I am really sweating from my forehead and dropping it onto my arm. And after like 4 drops in like 6 seconds, I'm like, wait a minute. I normally sweat, but not like that. Looked up and got hit in the forehead, and we had a leak in our basement. So have been taking drywall down and stopping the leak and getting a plumber that can come on Wednesday morning. So luckily it is not the whole water in our whole house, but fortunately had this all set up, so we're able to do this from home. So thank you for allowing that for me, and look forward to sharing with you a little bit about what's been going on at the hospital. Really exciting times for growth and strategy, and then just a really challenging time when we relate that back to now our 5th wave of COVID patients that we're experiencing in Marion and really across the whole country, but here in Marion County as well. So I'm going to spend just a couple of minutes or a few minutes sharing where we are and update on our master facility plan. I think the first time I got to speak with this group, we were just getting started in that process about 3 years ago, and now we're just nearing the end. Hopefully by June or July, we will have all of that project completed. We have another project that we started. I don't know how long they'll allow me to keep spending money, but as long as they do, I'll keep doing it to make sure our facilities meet the needs. And so I'm going to spend a little time talking about the Marion Cancer Center, and then just some exciting external benchmark accreditations and recognitions that we've received as well, which we don't do this work for those accreditations and for those recognitions, but it helps us to know that we're on the right track. So I wanted to share that with you as well. And then I'll turn it back over to David and Vicki to talk through the employer services component, which is a really important part of the work that we do as we move outside of the acute care hospital, but really think about improving care across the whole continuum, and how that plays out with employer services is really important. So let me spend just a couple minutes on the master facility plan. If you remember 3 years ago, or if you don't, it's about not quite a $47 million project over 3 years. The mainstay of that was the new East building that, if you've been driven by campus or been around, unfortunately not able to get inside a lot given COVID for the last 2 years, this new East building was the highlight and the most visible portion of what we've done. It is a 3-story building where the old library was and the old health department, and has 2 floors of private rooms, and each having 24 rooms. And then the first floor is the lobby, and then had shelved space that we'll get to in just a minute. But that has been up and running for just over a year now. We actually were able to open one of the floors about a month early in last winter's surge, so that we could have non-COVID patients in private rooms, but given how high the prevalence of spread was, to make sure that we were limiting that spread for patients who might have every patient was tested when they got admitted, but they might have been negative, and then within 1 or 2 days just weren't showing symptoms yet and weren't high enough to test positive. They would test positive. So in those semi-private room settings, placed a risk for non-COVID patients. So that helped us manage that surge. And then we opened up the other floor in the middle of January. So we're coming up on that 1-year anniversary for that floor as well. We have the endoscopy renovation over at Marion Medical Campus. One of our key areas of focus is on cancer prevention and disease prevention. And so that endoscopy unit was essentially old hospital rooms from when the Marion Medical Campus was a hospital. Very small for what we needed from a technology and equipment standpoint. So we've renovated that and seen significant growth in our cancer screening for lower endoscopies for colon cancer, and then also our upper endoscopy and heartburn clinic that has continued to grow. We did renovate the lobby over at Marion Medical Campus as well, and that's been completed. And then we did a renovation of the lab, the core lab or central lab at the hospital, to really help focus on the care of patients in the hospital through the emergency room and organizing that for efficiencies and new equipment as well. So those are all completed at this point, and there's just a couple of projects that are ongoing, nearing completion, will be done by the end of this fiscal year for us, the end of June. Good. So these are the ones that are in process here. So 2 South is actually now open to foot traffic. We're going through the terminal clean, final inspections, and likely opening up that space in February. So 2 South was a medical surgical floor. It had 17 rooms and 38 patients. So each room was semi-private. And the rooms were small enough when they were built, just at a different time. You could not have a patient, an assistant, and a walker in the bathrooms. And so we saw it as a big patient safety risk, as you had some elderly patients that were having trouble navigating all of that and risk of them being injured from a fall. So we turned those into 19 beds and 19 individual rooms with a much larger bathroom, and really looks amazing. The nurses station has been changed as well, and look forward to opening that up. The other just highlight of that floor is a new dialysis unit. So as we see an increasing population of patients in Marion with diabetes and hypertension, and the need for dialysis, to have a room where 4 individuals can be dialyzed in a more up-to-date unit. Just really remarkable to see that space as a healing space and a more comfortable space for patients that need to be in the hospital and have dialysis. The OB section is nearing completion as well. We have a new C-section room that is much larger and meets current recommended and requirements for maternity licensure. We have also a new waiting area and entrance, which can't be used right now. But if any of you had babies at Marion General Hospital and saw the old space, this space is remarkable compared to that, and is really a part of the lobby area on that 3rd floor of the new east building is where that waiting area is, coming in from that side. And then nurses stations as well, that helps us to provide better communication and connection and closer proximity to patients. We have a surgery piece in our recovery area that will be starting here likely the 1st of February. We need to get 2 South opened, and then we'll be able to work on this area to upgrade it as, again, for enhanced communication, safety, and processes in our ORs and on the Marion General Hospital campus. And then the all famous electrical upgrade, which to the facilities team, they love. You don't see a lot of it, but what this does is really putting in the infrastructure for new equipment, likely for the next 20 to 25 years, to have that ready to go moving forward. Go to the next slide. So that's where we are with the master facility plan. I would expect a little bit more renovation in the hospital to get pieces up to speed. One more floor will be looked at yet this fiscal year to upgrade the looks. It won't change the overall structure. It'll be our area that we plan to use as a private room area, but have capacity to flex when we have surges or increased cases to be able to keep that local, that we can turn them back into semi-private rooms if necessary. But the other piece that we're starting, and if you've been by the hospital, you'll see more construction on the south end of that new east building. We have approval to move forward with the Marion Cancer Center. This is one of the areas that we see as a biggest opportunity to help keep care local. And it also is an upgrade to our facilities to place everything in one spot, in one location, and that's on the hospital campus. We're going to centralize infusion services. This will be for both cancer and non-cancer patients. Radiation oncology for patients needing that, with a new linear accelerator, as our current linear accelerator had reached end of life. There'll be an education center as well for patients who have a diagnosis of cancer that can search for information and find information there to support both the care if they need to be in the hospital or after they've completed their course of care for their cancer. And then we'll have some updates to our pharmacy and lab to really enhance the mixing of the chemotherapy and other components as well at the hospital campus. We anticipate having the construction component done by the end of July, with then placement of the linear accelerator, calibrating it and moving it so that we should be open in October of this year for that cancer program. And looking now to continue to recruit and grow both radiation oncology and medical oncology here in Marion and at the Marion campus. So a lot of exciting things going on there as well. The last thing I wanted to share, just as an update for all of you, is some of these recognitions. One of the key areas for us as we look to solve problems and improve care is engaging all of our teams to do that and participate, because frankly, the nurses and the therapists who are involved in care know best what we need to improve. So one of those pieces from a nursing standpoint is a Pathways to Excellent designation. So the American Nurses Credentialing Center, larger hospitals have something called Magnet. This is a step that is similar to that, but because you don't have all of the infrastructure of a larger tertiary care facility, is a normal, at least starting place as you start to build that structure of shared governance and of empowering the nursing teams to do research and study how we can continue to improve care. And so that was about a year to year and a half process. The nursing teams created about a 200-page document talking about our quality improvement projects, the way in which we provide care, the way in which decisions are made, and then a survey of all of our nurses as well, which was done really during this past surge, that to get a certain percentage that participated and then scored at the highest level in each of the domains. And we passed with flying colors on that on our first attempt, which is just a testament to the quality of nursing care that we have in our facility and just the dedication that the nurses have towards working with each other, sharing and feeling empowered that when something isn't going the way it should, and then also looking for ways to be proactive. So just really proud of the work that our nursing teams have done to achieve this Pathways designation. The other component that I like to share is around health grades. There are many different external agencies that look at care. Health grades is one of those that uses publicly reported data. So hospitals don't self-report, but it's based on outcomes that we see, and all hospitals can be judged equally through that process. And Marion General Hospital received the award for being in the top 5% of hospitals in the country around our patient-centered care, our safety, and our quality as well. So you can see in that there was several other awards that came along with that. The most notable at the bottom there was our Critical Care Excellence Award, which really dealt with how well we care for patients with sepsis, with multi-system organ failure, those people needing an intensive care unit stay. And in the past year and a half, that's been a large number of patients with COVID, and creating the right groups of physicians, training our nurses, connecting the ancillary support teams has been phenomenal to really make sure that care can be kept local and not needing to be sent to another facility. You can also see that from an overall safety standpoint for patient safety, and you see that for stroke care as well. So a lot of work we've gone into programmatic development, and seeing these recognitions from publicly reported data comparing all hospitals in the country is something really proud of, and I know the teams are really proud of as well. And hopefully you'll be able to feel comfortable and share that your employees, those that need to use the hospital, can feel comfortable that you will get the best care possible by coming to Marion General. So thanks for allowing me the time to share. Exciting times for the hospital. We continue to work through COVID, and if there's any time at the end, anybody has any questions, be glad to share a little bit about that. But right now I want to turn it over to David and Vicki and share a little bit around the employer services in regards to fitness.
Thanks, Dr. Gingrich. I really appreciate you having, and the chamber having, Vicki and I here to speak today. I think it was maybe 2 years ago, I know it was pre-COVID, where I also joined Dr. Gingrich to speak about some of the stuff that our division of employer services are doing for our employer partners. And we talked a lot about our walk-in clinic that we had developed at our work health clinic. And while that's still up and running, it's kind of taken a pause due to COVID, unfortunately. COVID did that to a lot of employers, where we all had to take a step back and the world shut down briefly, and we had to kind of take stock of what we were doing. And in that time, we didn't just sit idly by and not do anything. Our team in employer services really sat down to, one, support some of those employers that were considered essential and didn't stop working, because not everybody stopped. And two, look at some of those services that we as a division could provide to our employers, or we're providing, and how can we make those things better? So our division of employer services really partners with employers to add value, right? So everybody in the community knows really the anchor of our division of employer services is our work health clinic in Marion, right there on Center Street. So between the occupational medicine we provide and some of the low acuity care that we can provide at that clinic, that's really how everybody knows our division, right? They kind of know us as the work health clinic. But really our division is a lot more than that. And we've developed over the last 10 or so years to provide other services to our employer partners in different areas. And so as we look at these kind of different buckets that employer services provides, we look at work health, bread and butter. We've been doing that for a really long time. We have occupational health clinics really all around the system, down in Athens, over in Mansfield, and then 5 work health clinics in Central Ohio, in addition to what we have in Marion. But on top of that, we have wellness offerings that we bring to on-site to employers, which of course that's slowed some because of COVID. And we've kind of seen increases and decreases based on surges and what's going on in the community. We have on-site clinics. So if you think about our work health clinics, we have those inside of employer spaces where it makes sense. So you think of larger employers and employers that are seeing kind of high volumes of occupational injuries and things like that. We actually have on-site clinics in some of those spaces inside of employer spaces. And then really the last, and I think the most exciting for me with my background of sports medicine is the fitness kind of space that employer services is in. And what we've been able to do, because it's not just fitness, it's really a lot more than fitness, but we use that kind of term fitness to bucket this. And Vicki's going to talk a little bit about kind of what is included in that bucket, right, of fitness. It's a very broad term, and kind of what she does on a day-to-day basis in her role as an exercise physiologist. But really wanted to make sure that everyone in the group really understood all that employer services can do to kind of create value and add some value to our employer partnerships across the system. It's not just in Marion, although that's where I spend the majority of my time is in Marion and down in Delaware, but really across our footprint of OhioHealth. And then in those buckets, you can kind of see some of the things that are broken out. So again, back to if you look at the work health bucket there in the middle, we talk about occupational injuries, we talk about drug testing, physicals. That's the stuff that really everybody knows us for. But it's these other buckets that we've really spent a lot of time working on those offerings. And I'll kick it over here to Vicki to kind of talk through specifically this fitness bucket, and then we'll kind of dive into some more specifics.
Yeah, thanks, David. As David just mentioned, our footprint is pretty wide, right? So I am a supervisor at our corporate fitness centers. So I'm actually located in Akron, and I oversee some Columbus. So just to kind of give you an idea of where we're at there. So this slide, again, breaking down the services that we provide, wellness and fitness can kind of get very gray because our teams work so closely together. So to provide these exceptional services, and in these last 2 years of unpredictable times, our teams have been able to pivot greatly, and really we've succeeded by really getting into that virtual space. And how do you do that in fitness? And that's always been that question, right? How in the heck do you do that in fitness and get that engagement through that wellness, through those wellness offerings? So I just want to take a moment to dive a little bit deeper into the wellness consultant side, more specifically as it's relating to the program offering. So this is slightly different from the fitness offerings, as the consultant is more of your face or wellness for you and your employees, and they can roll out programming and are the liaison between your employees and the services being provided. So as David mentioned, I'm an exercise physiologist. We have registered dietitians, we have health educators, a lot of different professionals, and we can get a little bit more specific into the needs that your specific needs. Okay, so they're dedicated to helping you coordinate and communicate and implement programming that both motivate and fully engage employees. It's a great aspect of having a wellness consultant or coordinator, as they are able to allow customizable programming by utilizing needs and interest surveys. This providing feedback to the employee's employer of interest, also in services maybe the employees are not aware of. So it's a great lens into what aspects could be reconsidered or maybe even communicated better. And then, so this year, just I talked a little bit about, kind of that assessment portion. So a wellness consultant would conduct assessments by analyzing the health risks of specific population. They'd also be in planning and managing that design, that incentive design and structure, and establish committees to help drive that engagement, as well as to work with brokers and other vendors, depending on what your needs are. Implement and engage by coordinating and carrying out events such as biometrics or programming specifically by portal assistance, if that's something of interest in overall culture. Then they evaluate, they measure and analyze program engagement, satisfaction, as well as health claims, employee health risk data. They can go as far as they need to go, depending on what your interests are.
And I'll even add on, Vicki, to that point, that health claims data and that utilization of data. I think now more than ever, our team is really engaged on the data side of things with brokers, analyzing insurance claims and looking at the total population and what spends are across the board. We know that spend continues to go up. And I think our team, the business development team working with the fitness and wellness team together, can look at that data and really, to your point, Vicki, make some customized programs to target some of those things. So it's not just blanket programming, although we have some really kind of high level programs we can start with. We can really drill down to some of those details and look at your spend and look at the data and try to affect the population and kind of move that needle for your population. And I think that's something that we had been doing prior to COVID, but COVID really gave us that time to take a step back and analyze where we were with our data utilization and what we were doing with that data. And it's just been tremendous to be able to kind of take a step back, because you don't always have that ability to. So as bad as COVID has been on a lot of different levels, I always am the kind of person, I'll try to find the good in everything. And that's been one of those things where it's given us a time to kind of drill down to some of these things. So thanks for really touching on that data thing. I didn't want to just breeze over that, because it is a critically important piece of information that our employers get. You're getting that data from your insurance company or from your broker, but what are you doing with that data after you've received it, right? And that's kind of where we can come in and help understand that data and work with the brokers and work with the insurance carriers to kind of develop something for the employer group. So I think that's really important. a lot of that's the work that Vicki's team is doing, right? Is once we've analyzed that data, they've got to, put the programming out there and put it in place and make it work and drive engagement. And they've done a really good job with that throughout these last 2 years of the pandemic. So.
Absolutely. I agree. Absolutely. That's a great call out, David. As mentioned previously, the fitness and wellness team works extremely close together. If you were to have fitness services such as the live group fitness schedule we have, is including our on-demand library, as we know that most people schedules look a lot differently now. So it's an on-demand schedule that can meet their needs. And those services run from anything from 10-minute kind of get up and move that they can get into. Again, these are live classes also offered on demand, all the way up into 60 minutes, including those Zumbas, those yogas, the just general basic strength training classes offered throughout the day. And then I just want to, just the variety that's out there that we've been able to have has been fantastic. And then before I wrap up, one thing I'd like to mention is that on-site coordinators, the ability for them to be on-site compared to off-site, their ability is that much better to make a larger impact, as they are more kind of in the weeds, is what I like to say. They're more hands-on, especially interactive programming. And nowadays, with us being more in a virtual space, that one-on-one contact that some of the programming, if they were to offer in person, really makes a difference. So, people are kind of striving to see people face to face nowadays. So I did just want to call out that the on-site consultants can definitely make a huge impact on programming as well.
And I think, going back to the manufacturing side, obviously this is the Manufacturers Council, and we think of manufacturing not necessarily having time, right? We have people on the line, typically hourly. They don't have 60 minutes to work out. Well, we've seen that, in some of our other settings, specifically call centers and things like that, where people are hourly, they're expected to be on the phones, they're expected to be doing things. We've seen great success in a lot of those short 10, 15-minute classes, really trying to engage those folks to get up, to move, and to do things different, as opposed to just sit at their computer like this all day and make phone calls. And that can translate so easily to the manufacturing space. Maybe folks aren't sitting down like they do in call centers or in offices, right? They're on a line, they're doing repetitive motion, or they're doing kind of the same couple of things. But we can still engage in that population of folks and make big, tremendous impact on those people that are doing repetitive motion, that are doing repetitive tasks, or don't have time outside of work if they're working 12-hour shifts to find time to get fitness in. And I think that's one of the things that manufacturing kind of gets a bad rap for, but we can certainly engage in those populations with folks and find those little 10-minute break classes to engage with groups. It worked a lot for me when we were at our corporate fitness center. I spent a lot of time sitting at a computer like this, and our exercise physiologist would come up to our desks, and I didn't want to stand up and stretch, and it feels a little goofy at first, but you do see tremendous impact in just stepping away from your computer or stepping away from something for 10 minutes and just stretching and moving around a little bit. It certainly helped me when I was working in the corporate building, and I have to find time to do that now that I'm sitting at home in the same kind of bad posture. But I just wanted to make note of that too, because I feel like we want to make sure that the Manufacturers Council group understands that it's not just salaried office people that we're trying to really impact. We can impact really it's the entire population of folks that we're really looking to make an impact with. So
I will add on to that is that 10-minute class, those 10-minute classes we offer twice a day, one in the afternoon and one in the morning. It's one of our most utilized classes. And again, going back to that data piece, we're able to draw that data and provide you with numbers about how many people are, well, specifically how many people are joining at what times. So that's another great ad. We have a lot of people thank us for 10-minute classes because they don't have a lot of time and that they join both.
And we've got some time for some question and answer, I believe, right, Matt?
Absolutely, yeah. And I can kick us off, and then unless anyone else has a real pressing one. But just back to the fitness, in terms of the engagement, great presentation, again, thank you so much. For the fitness, how do you I guess, drive engagement with the staff members, encouraging them to want to stay healthy? What's some examples of that, I guess?
Vicki, do you want to take that or do you want me to take it?
Yeah, so it kind of looks different everywhere. I feel like if it's consultant or whether it's more on-site. So that communication is huge. We use general emailing. Consultants might be able to reach out slightly differently, but it's really, everything stays pretty regular. It goes on quarterly, so they know what to expect. So once they're in and they're engaged and they're communicating through whomever is, their on-site communication, it usually runs fairly smoothly is basically what I'm going to say.
Yeah, and I would say even I can give an example of one particular public entity that we work with where we have an on-site wellness coordinator who is also an exercise physiologist that interacts with folks on a daily basis at different stations. Throughout the pandemic, they've had to flip to remote or to virtual and then back to in-person, just depending on where we're at with the current surge, what the positivity rate looks like at each station. And really it's building that rapport of that on-site wellness coordinator or that exercise physiologist early with your populations. And I think our team does a really good job of building that rapport. Not everybody is super excited to work out all the time, but we realize how important it truly is to move every day. And so I think that exercise physiologist in particular that works with that public entity spent a lot of time in those stations when positivity rates were lower. It was safer to be in person, masks and social distancing, building that trust, working on teaching folks what fitness really is. Because again, I think if you just think about fitness, maybe your head goes to CrossFit or maybe someone else's head goes to walking, right? It could be that entire continuum. And really what we're trying to do with that particular group is just make it functional for that particular job that they're doing. And so really match your question. It's building that trust early with our groups and making sure that we understand where everybody is on that kind of continuum of fitness and trying to make it as functional as possible for those jobs.
And I'd have to believe that you're building programming around what the employers have specifically asked for, what you've seen, where gaps existed or where the needs are. So and that's great that you guys have had the time to respond to some of those as well for this.
Yeah, and with Vicki as an exercise physiologist, and she could speak to it better than I can, but those assessments when they first get started with a group are crucial to understand, for the folks that are going to participate. In some situations, it's mandatory, like the one I just talked about. It's mandatory to engage with the exercise physiologist, which was a little bumpy at first, but we've gotten to a point now where it doesn't feel mandatory. Or if it's optional, that assessment's still key to seeing where the employees are at, or where, we'll call them patients or clients, right? Where they're at in their fitness kind of journey. So that assessment, and Vicki does this on a regular basis, is really critical to starting that journey.
Awesome.
Yeah, to provide you another example is, the employer who I am with on site, we spend a lot of time going from, department to department and kind of creating that wellness network, somebody that may be interested in kind of being the promoter. Maybe it's a manager of a certain department, and then they kind of grab on and then they help communicate it. So it's really about developing that culture. So whomever your point person is, whether it's just, somebody in HR or that coordinator is helping develop that culture and how they're going to communicate. So it really just depends who all is involved in it, whether it's on-site, whether, it's via virtual only, if it's somebody coming to on-site to a specific area. So yeah, it's definitely helping that coordinators developing that communication and culture.
Awesome. And in a time when we're all trying to retain our workforce, having programs like this, I believe, I'm assuming, be a very great added benefit and keeping your staff healthy. And if someone was interested in this program, would they reach out to you, David, or Vicki, or who would they start?
Yep. Yeah, they can reach out directly to me in Marion and then also in Delaware. That's kind of the areas I spend the majority of my time for Ohio Health Employer Services. But, it's us and the fitness team together and the wellness team. We really work as a big group. So those initial requests, or even if you just wanted to sit down and talk about how a program could be structured, we could sit down and have those conversations and say, hey, this is how we've done it at these different locations. This is what's worked well in our experience, but we're always looking to do different things and try new things. So yeah, absolutely. Please feel free to reach out for any of those kind of other things that we talked about today.
Any other wellness program questions? If not, I was going to shift back over to, I guess, Ohio Health itself. And
Sure.
do you feel like staffing in general has been an easy thing, or for you folks, or what's staffing been like, or in Ohio Health?
I can give my small glimpse from employer services. Then, of course, Dr. Gingrich has the kind of the overall glimpse of the entire system and also of Marion. I think from our division, it's been a little bit challenging on the staffing side. I think we're starting to see more of our folks in quarantine testing. Our positivity rates are higher, and we're doing the best we can, especially at our work health clinics and in some of our on-site facilities. But we are starting to feel that strain, in our division. And I think that would kind of go along with how the system, and I'll let, of course, Dr. Gingrich speak to that a little bit, but it's been challenging for sure.
Yeah, David, and thanks, Matt, for the question. Just like most companies, we're seeing significant shifts in the way people want to work. And in the acute care hospital setting, especially, we're seeing those challenges as people continue to deal with settings at home, with daycare, schools, quarantines, all of that component, and just the overall stress and resiliency of now spending almost 2 years managing COVID in the hospital. As I mentioned earlier, this is the 5th wave that we've had. And for us here in Marion, this is probably the second highest wave that we've had in terms of patients in the hospital. Last winter was the highest, but last winter we took patients in our hospital from 47 different counties in Ohio and 2 different states because of how severe that was. In the fall, and then this time we are focusing on where our service area is. So that's Marion, Hardin, Morrow County, and then we do have occasional patients from Crawford or Wyandotte, but really focusing on that 3-county area, and patients who see doctors at from our hospital, we'll bring them in. So we've been able to manage our flow just a little bit, but when you look at the severity of illness, when you look at the time people spend in the hospital, it has taken a pretty significant toll on many individuals who've decided to retire or decided to take some time off to try to redecide what they want to do from a career standpoint. So we're continuing to see that challenge and continuing to help support through things that many other companies deal with around wage management, flexibility in scheduling, and focusing on resiliency to help support people as they continue to work through this time. You may have seen in the newspaper and the Marion Star late last week that we will this time availing ourselves of the National Guard to help support us. They will be here tomorrow morning to help support in non-clinical ways so that the nurses and the other clinical staff can focus on the patient care. They'll be there to help those other functions so they can spend more time taking care of the patients. This is now the 4th time that we've had to pause non-COVID elective surgeries in that process. So anything that is more urgent or has a risk of progressing significantly, we're still doing those cases. But the other cases we're pausing on so that we can have some additional hospital beds. That's about 10 beds a day, and 25 or so staff out of our ORs are out working on the floors, taking care of other patients who have non-surgical needs, COVID and non-COVID, and just support our teams as well. So really challenging times to live through, as I'm sure it is for many of you and your companies as you continue to try to find a stable workforce to move forward. But we're surviving and looking at hopefully over the next 15 months or so, we'll get back to a place where we've got some stability in that, but don't anticipate that much sooner than that from a healthcare perspective.
Thank you, of course, your staff, everyone there is heroes, and thank you so much for everything you've done through all this for the community. And speaking of that, I think there was not too many weeks ago, maybe it was last week, I think you sent something out, Curt. Is there anything that I guess businesses can do to, I guess, show their appreciation for the nurses or staff members?
Yeah, thanks, Matt. I have continued to be so humbled by the sacrifice and the dedication of the teams here in Marion and through all of OhioHealth, but where I focus is here in Marion. The ability to provide compassionate care when they've got sick loved ones at home, they've got their own fears and anxieties over all of this, and then just the time that this has gone on. We've seen so many companies in town just support us through everything from sending some coordinating with us and sending some food and support, letters of support, encouragement to the teams. And that really means a lot to the teams. And so anybody that has that interest in supporting in that way can certainly reach out to myself, Joe Dziedzicki, who can help us with that as well. And it just means a lot to those teams. One of the things I really enjoyed was coming in the associate entrance and having cards and pictures that were done by several of the elementary schools, just thanking people for caring for our community, and to watch people as they were leaving from their shift or coming in to just stop and read a few of those, and the smile it put on their face just really helped. So any little thing like that, any of those gestures can really be helpful.
Other comments, anything from the chat? I'm not seeing anything. Well, thank you again. Sounds like some very exciting developments. Jill says, we have an adoptee unit program we're looking for support on. Jill, do you want to talk a little bit more? Or?
Yeah, I'm figuring out how to unmute on Zoom. We're used to WebEx, sorry. Yeah, we're looking for approximately 9 organizations. We already have quite a few, just to do any number of things to support some of our clinical and non-clinical units. Our non-clinical units have also struggled through this. Our EVS workers, our nutrition services, not on the front line with the patient, but just critical in the care that we provide and the support they give our teams. So everything from making cards to providing snacks, anything like that. We have just a number of ways that companies can support our teams. Some require budget, some don't. And so, Matt, I'd be happy to forward that to you if anybody has interest. Please have them reach out to me. I'm working with our HR team to coordinate that support. So would be just thrilled. I know our teams especially would be thrilled. We're looking at lots of ways to just help them with resiliency. That's a big priority for us right now. We're very, very grateful to have them and have them caring for all of our patients. So if anybody would like to do that, if you want to reach out to Matt or to me, that would be fantastic. Thank you.
Absolutely, I can absolutely share that along with the slides and so recording after this presentation is over. From Chris, thank you for the updates and all that you were doing for Marion and the surrounding areas. Thank you, Chris. All right, well, with that, barring any other questions, and again, you can reach out to, I'll be sharing their contact information for anyone on this call and those that are watching the recording. I'll have the contact information as well. So thank you again to David and Vicki and Curt and Jill for providing those updates. And thank you for those that are watching this or here in person today. And we will see you all next month. Oh, if not, the annual meeting on February 11th at the chamber here. Thank you very much.
Thanks for the opportunity. Stay safe, everyone.
Thanks.